Good afternoon, everyone. Welcome to the City Club of Eugene's February 9th, 2024 program, What's New at the Balmer Center for Children's Behavioral Health? My name's Andrew Kallick, and I am City Club's president. We're coming to you from our home at the 5th Street Market in the heart of downtown Eugene, and it's my pleasure to extend a warm welcome to our speakers and to all of you joining us in person, online, or over the radio. For 3 decades, the City Club of Eugene has remained dedicated to its founding mission to build community vision through open inquiry. In accordance with our mission and purpose, we hope to connect people throughout our community and across generations, identities, experiences, and perspectives. You are invited this week and every week to join us in this effort, to share your wisdom, learn something new, and take active steps to make a difference in this city and region we all love. Of course, we cannot do this work alone, so a special thank you to our Platinum, Community, and Diamond sponsors. The Eugene Area Chamber of Commerce, serving as a catalytic leader in creating a vibrant and diverse economy that drives economic opportunity and well-being. Kaiser Permanente, which exists to provide high-quality, affordable healthcare services and to improve the health of our members and the communities we serve. More information at www.kp.org. The University of Oregon has helped Oregonians question critically, think logically, reason effectively, communicate clearly, act creatively, and live ethically since 1876. Get more information at uoregon.edu. Peace Health has been proud to serve Eugene, Lane County, and beyond as your hometown healthcare partner for more than 80 years. The Peace Health mission is to keep you and your family healthy. Learn more at peacehealth.org. Lane Community College transforms lives through learning. LCC provides comprehensive, accessible, high-quality educational opportunities that promote student success. For more information, visit lanecc.edu. The AARP of Oregon is a trusted and positive force for social change, using the experience and leadership of volunteer members to benefit all Oregonians as we age. More information at states.aarp.org/Oregon. And thank you to the City of Eugene and Lane County for their support as well. Whether you're joining us for the first time or you're a longtime listener, I invite you to support our work by becoming an individual member, a business or community sponsor, or to suggest an idea for an upcoming program. You can do all those things and more at cityclubofueugene.org. Your support and engagement make these community conversations possible. And of course, City Club is not just about conversation, it's about taking that conversation and translating it into action. And it is our hope that with informed understanding, you will engage in the issues impacting our community, including today's subject, the public health challenge facing many of our youth, and how the University of Oregon's Balmer Institute is trying to tackle it. With that, I'll turn the mic over to Mary Layton, the coordinator of today's program, to introduce our panelists. Mary.
Thanks, Andrew. It's not surprising that the University of Oregon has come up with yet another idea that can help make public education work better for everyone. In 1970, I was assigned to my first classroom in Walter Scott Elementary School in the Woodlawn neighborhood of Chicago. It was what we called in those days an inner city school at 64th and Blackstone. I had a degree in sociology and a few post-grad credits in education, but this school was one of the few in the country trying out the new DISTAR reading program developed at Oregon. Despite being a rookie teacher, I was able to make readers of my students, all of whom had special needs. 30 years later, I was the director of high school reform in a rural school district in Maryland, populated mostly by farmers and fishers. The teachers were collectively able to increase student engagement and achievement by implementing PBIS, Positive Behavior Interventions and Supports. This was another program born at the University of Oregon. After many years as an elementary and high school teacher, administrator, and policy researcher, I graduated from the workforce and became a grandparent school volunteer. As those of you who have joined these ranks know, this assignment also often involves passing through the admin suite, signing in, stopping to chat with the front desk person, and invariably, there's a kid waiting to see the principal. One day in recent memory, I was waiting until the dust cleared from a recent fracas. I turned to the kid sitting next to me and asked, "What are you in for?" He signed resignedly and explained that he had pushed the wrong kid. It was just a bit of schoolyard meanness, but the victim responded dramatically, and it became a very big deal. At that moment, the victim came through the door, still visibly quite distraught. I knew him. I had known him for years, not well, but well enough to guess at his diagnosis, given my own training and experience. The problematic behavior was predictable, very disruptive, and likely preventable with the right set of behavior management tools. Not easy to manage, but capable of management. When I heard about the new undergraduate program at Balmer Institute, I was a little skeptical. But recent family events have made a Balmer believer of me. In the last year, my 15-year-old grandson has directed a new and intense focus on all things theatrical. This led to a new ability to critique professional performances. We've been going to plays for years, including Broadway, and now he notices aspects of performance that give him insight about what's going on and whether it works or not. Ask him for a critique of To Kill a Mockingbird. I realized that when we focus on patterns that are meaningful and predictable, we can learn to see and cope with them. My grandson can't yet write a play or direct one, or even yet act or sing as well as his more experienced classmates, but he can observe and respond to performance factors because that's what he has studied, often for hours a day, even on weekends. Patterns of behavior that are meaningful and predictable are the focus of students' work at the Balmer Institute, launched with a $425 million gift from Connie and Steve Balmer in the spring of 2022, and already winning prizes for its accomplishments. In this program, 2 members of Balmer Institute's leadership team will describe work in progress, plans for welcoming rising juniors to the UO Portland campus this fall, and ways the new undergraduate major will provide better support for the children of Oregon. The principal of a local school that already uses some effective Made in Oregon strategies to help students with special needs will ask the first question. Randy Camphouse is a senior advisor for external affairs at the Balmer Institute. His side gig for several years has been being the dean of a college of education, but he was a distinguished research professor. His current work employs universal screening measures in schools to identify children with early indications of behavior and emotional risk, to provide information for deploying social emotional learning and secondary preventive measures, and to monitor children's behavioral health status. He earned a PhD in Ed Psych from the University of Georgia. Courtney Westling is the Senior Director of Public Affairs at the Balmer Institute. She has spent the past 2 decades working to address systemic challenges facing children and families, including working for Portland Public Schools. Her experience includes roles in developing stakeholder engagement, coalitions, legislative strategy, and public policies. She earned an MPA from George Washington University. We start with Randy.
Thanks for the kind introduction, Mary. A few preliminary remarks. It's good to see some friendly faces here, including one of my former bosses, Scott Coltrane, during his service as interim president of the university and as provost. But seeing Scott reminds me of the backstory of the Balmer Institute that I should share with you. And that's about the importance of administrative leadership at a higher education institution such as the U of O. And one person who deserves considerable credit for the genesis of the Balmer Institute is Provost Patrick Phillips at the time. When Patrick was serving as provost, he had the astounding idea to bring faculty together from across campus, from psychology, from the College of Education, including myself and many others that you'll see on the Children's Behavioral Health at uoregon.edu website. And these faculty came together at the request of Patrick to try to come up with a bold, forward-looking idea that was novel nationally and internationally that would better serve the behavioral health needs of children. So many people don't know that this is an administratively led, in large part, initiative of the University of Oregon. Couple other preliminary remarks. As Mary noted, I have a conflict of interest, and I want you to be aware of my conflict of interest because I receive royalties for the measure that she mentioned. Secondly, we're going to talk about some sensitive topics here, and I want you to be aware of that. Like many illnesses, health conditions, behavioral health is an epidemic, and it strikes virtually every family in some way, either direct or indirect way. So forgive me if I mention some topics that could be upsetting to some individuals, because all of us, unfortunately, are affected by these challenges. So beginning now with the Balmer Institute, I'll give you an update as requested on the current work, and Courtney will cover some aspects of that work as well as we switch out the slides among one another. One of the exciting things about being at the Balmer Institute is that we're all so committed to the work. And this is most enjoyable to be able to work with people like Courtney and Kate McLaughlin, our director, and others, because we're all there because we want to be there. We want to face this children's behavioral health challenge that sadly, as I'm sure you know, is absolutely not new. It's long-standing. So let's speak about that long-standing challenge. And it has been worsening pre-pandemic. We don't have as good of data for children and youth's behavioral health, mental health status, because we just haven't tracked it very well as a nation. Just to give you an example, the first report by the Center for Disease Control and Prevention on the epidemiology of children's behavioral health was not produced until 2013. So there's a distinct lack of knowledge that we're just coming to grips with as well. But the information that we do have suggests that this is a long-standing problem, getting worse pre-pandemic, and then accelerating in light of the pandemic. So these, if you'll notice the legend at the bottom, the dark green leaves are children and adolescents with low risk. The lighter green leaves, more of a UO color perhaps, are youth with some risk. And then the yellow leaves, again, I guess this was chosen for us, indicates high risk for behavioral and emotional problems during the developmental period. So let's talk about the existing behavioral health workforce, which has been a challenge. And just to give you an example of the challenge, I saw an ad the other day for a school psychologist, and as any of you who have worked with school systems know, they're virtually impossible to hire. I was speaking with one of my alumni in Denver a couple of weeks ago, and the average number of applications that they get for school psychology jobs is 0 to 1, somewhere in that range. When I entered the field a long time ago, I'm coming up on 4 decades in this field, there was a workforce shortage. And it's pretty much the same magnitude as it was almost 40 years ago. So we have this collision, this extraordinary collision with accelerating need and a static behavioral health workforce for children and our youth. And sadly, as any of you know, if you have a child or a grandchild with some behavioral or emotional challenges, it's extraordinarily difficult to access services in a timely way, regardless of whether or not you have insurance, regardless of your personal resources. It's just an extraordinary challenge. Senator Wyden has been a big supporter of the Balmer Institute from the outset, and the Senate Finance Committee in 2022 produced an authoritative report on the status of mental health and mental health service delivery in the country. It's a great read on the Senate Finance Committee website if you decide to look it up. But the average wait time to receive mental health services in the U.S. at that point was 11 months. So the challenges of have been, as I've mentioned, we've been facing for a long period of time, but it doesn't mean that it's easy to face these challenges. We've tried many things. We've engaged in extraordinary efforts to expand the workforce. We've tried recruiting students from high schools into undergraduate programs and graduate programs into the behavioral health workforce. We've been trying to diversify the workforce as well, so that when children and youth come into a care setting, they get to see someone who shares many of their demographics. And we've not been successful at that either. So here we are with the challenge, and I feel very fortunate to be at the University of Oregon, because quite honestly, this feels like the first time in my career where I'm actually doing something that has the potential to make an extraordinary difference. So that's the workforce story, a very challenging one. And what we're trying to depict in this particular slide is the existing children who have behavioral and emotional needs, who are typically classified or diagnosed as having a mental health disorder, which means that their needs have progressed. Their challenges have progressed to the point where they need significant behavioral health care services. And these statistics have been with us for a long period of time. You'll see these on the CDC website, but we've known for decades that if you take a sample of households in Eugene today and you just knock on doors, you'll find that about 20% of the doors that you knock on will have a child who has a behavioral health condition. And of that 20% of children who have a behavioral health condition, only about 40% of them are getting any service in this particular calendar year. So this 20% of the population that carries a diagnosis or does not carry a diagnosis but has a significant mental health challenge that's actually diagnosable is underserved with the existing workforce. But it becomes even more challenging because there's another group of children who have some risk who do not have a mental health disorder or a mental health condition. They have a precondition. And it's analogous to healthcare, where you hear terms such as pre-hypertensive, right? Pre-cancerous, any pre-diabetic conditions, and you engage in lifestyle interventions to try to mitigate progress toward the disease state. That exists in children as well. And so we have this additional group of children that we are unable to recognize and we're unable to track. And these are children who have 1, 2, 3, 4, or 5 behavioral or emotional concerns. In medical terminology, you would say symptoms of a mental health condition, but they have these early concerns, and their parents are unaware of it, and their teachers are unaware of it, and in some cases, the youth themselves are unaware of it, but they just feel uncomfortable. We have no way of identifying those children with concerns because we don't have any sort of system for identifying these kids in any accurate way and tracking their concerns so that we can change policy and change practice to meet the needs of these children. So these kids I refer to as sort of the missing middle. We have kids who are developing fairly typically, and they have a typical amount of risk. They have problems now and then like we all do, but they they're not developing significant symptoms of a behavioral or emotional problem. And then we have this other 20% that I mentioned to you previously who have a bona fide mental health condition that could be diagnosable. So we have this group in between, and we don't even know the size of this group at this point in time because we're so early on in tracking these kids who are part of this missing middle with mild to moderate concerns. It could be 15% of the population. That's one of the lower bound estimates. One of the higher bound estimates is about 40% of children. So that group is the group where the Balmer Institute has a chance to do some preventive work, where we all have chance as a society to do some preventive work. If we can identify these preconditions and engage in the sort of lifestyle interventions, the early interventions that are less expensive, less invasive, and intervene early, we can mitigate progress toward development of a mental health disorder. We can increase the satisfaction and in the family. We can reduce the amount of suffering that a child or adolescent has to experience, that they would experience if we don't intervene until they're fully depressed, for example, or suicidal. So we can reduce or eliminate considerable suffering if we can detect kids early and then engage in early preventive interventions. And as you can imagine, we don't have a workforce for the 20%. That's an 11-month wait list. We don't have a workforce for the 15 to 40%. We do have a workforce, but it's very difficult to even identify that workforce, let alone the kids that need to be served. So those are some of the needs, and here's how we're thinking about it. Early identification and promotion. From the promotion side, we want to do a good job of helping teachers, families, and others who are serving children to deliver these sorts of lifestyle strategies that we all need to better cope with the stresses in our lives. So the daily stresses, the sadness associated with the loss of a loved one, for example. We all need strategies as adults, as young children, and as adolescents to deal with these sort of emotional bumps and bruises that we have in life. And we're beginning to realize as a society that we need to actually instruct children in these sorts of strategies. So this is why it started long ago in the Midwest, but Oregon is, I think, the 23rd state to pass mandatory social emotional learning in classrooms. And this is part of the realization that one aspect of schooling that's really helpful and really important for kids is the social, emotional, behavioral development that goes on at school as well as goes on at home. That falls under the general heading of promotion. And we do not have a promotion workforce. I'll mention later a micro-credential program that we have for teachers at the Balmer Institute. And the teachers are very, I can't really say enough good about that particular graduate program that we're offering through the Balmer Institute and the U of O because the teachers are eager to learn more about behavioral and emotional development and the behavioral and emotional diversity in their classroom and how they can help children develop their behavioral and emotional competencies. So that's not exactly a social emotional learning workforce either. So that's a gap that our profession, the child behavioral health specialist profession, will hopefully help fill. And then secondly, prevention intervention. These are the missing middle kids where we don't have a readily identifiable workforce for helping these kids. Because we're, so stressed dealing with the kids that have the severe impairing problems. And this is where we're proposing to do universal screening to identify these kids and then intervene early when their problems are relatively mild. On the topic of prevention intervention, first you have to identify these kids. And it's important to note that behavioral and emotional development is one of the only things that we don't screen children for. So if you've worked in schools, you know we screen your kids for vision, we screen them for hearing, we screen them for math, we screen them for kindergarten readiness, we screen them for scoliosis, we screen kids for lots of things, but in the behavioral and emotional realm, only about 25% of kids are screened. And that's nationally, and they're typically screened at schools. In 2022, advised pediatricians to routinely screen young children for anxiety problems, stress, worry, and to routinely screen adolescents for depression, because that's when it really begins to get severe. And so screening now is a movement. This early identification is a movement that is beginning to get a foothold in pediatric practice, in school practices as well, so we can identify kids when they're mild and cut these problems off and mitigate the suffering that would be associated with the development of a full-blown mental health disorder. And then our curriculum will provide students with some strategies that they can use for kids who carry a diagnosis, and that is kids who have been identified in adolescence with a substance abuse disorder, for example, or have been identified as having some suicidal thinking, for example, or they're unable to show up for school because at school because of their excessive worry and anxiety. So our curriculum for undergraduate program I'll describe to you in greater detail, and Courtney will help me with that, but it's primarily aimed at the first two tiers here, and that's the prevention, behavioral health, promotion end. So this is our model. The Balmer Institute has been ambitious from its early conceptualization, and that means we're going to try to do everything to support the behavioral and emotional development of kids. And that is we're going to try to be inclusive. We're going to engage communities that Courtney will speak to. We'll engage in research and innovation. We'll do teacher and other professional group training. But the core activity is to create an extra pair of hands, because that's what we're lacking most, is just the person power to help kids. This is a slide describing our executive director, Katie McLaughlin, and Katie is an astounding psychologist. One thing that's not mentioned on the slide here, and here you see all of her credentials, which are extraordinary and quite impressive, but 2 or 3 years ago she was cited in the top 1% of mental health researchers in the world. And so she has an extraordinary record of helping children and youth, and has been engaged in workforce development previously during her work at Harvard, and she is, all the work that you'll be seeing from myself and Courtney today has her fingerprints and her leadership all over it. So I bring you greetings on Katie's part. She couldn't be here today, but you can find more about her in the at the Children's Behavioral Health website. So this is our undergraduate program. It's unprecedented. There's not one like it. It's an entirely clean sheet of paper that we had to work with. No one had a name for this profession. That took some time. There are no accreditation standards for this profession. There's no credentialing for this profession. It is a complete invention of the psychology and education faculty at the University of Oregon, which is really exciting for the reputation of the University of Oregon to be the first to develop this idea of a new profession, which is really exciting and really daunting at the same time. And Courtney will describe some of the daunting parts. So we proposed it in the summer of '22 and had it passed by the Higher Education Coordinating Commission in December of 2022. That is a world record for the University of Oregon to get something launched that quickly, right, Scott? So from the outset of the Balmer Institute, we've been breaking the speed limit every day. which is actually part of the excitement of the whole thing. And we have some first year and second year students enrolled in the program here in the Eugene campus. And then we'll have third year students next academic year. We have the Balmers provided that $425 million, but they tried to think of everything to make sure that this was a success. So $100 million of that is for student scholarships in this new undergraduate degree program, which is intended to improve access for everyone who wants to pursue this degree, regardless of their financial capabilities, which is amazingly exciting. And we're working with community colleges to have individuals transfer into that third year at the UO Portland campus. This is the faculty. They're as amazing and interesting as Dr. McLaughlin is. And you'll find more information on them at the Balmer Institute website. We've got one more tenure track hire coming, maybe a second one in the next week or two. But the Balmers gave us funding to hire 25 faculty members, which is unheard of as well. And it shows their commitment. It also shows their wisdom, that if they really want this to work, they have to be all in. And that's why that 425 figure seems so high, because it gives us an extraordinary chance at making a breakthrough in children's behavioral health. And what I'd like to do now is ask Courtney to come up to the microphone briefly and share with you a little bit about the credentialing and the work that she's been doing as a Director of Public Affairs, which is very timely work. She with Dr. McLaughlin were just in Salem this week, and I want you to get the most up-to-date information on that work, if you'd be so kind.
Good afternoon, everybody. I'm Courtney Westling, as Randy said, Senior Director of Public Affairs at the Balmer Institute, and have been there just shy of a year, but come from other systems like public schools and state health care agency, et cetera. So my role, as Randy said, we have a daunting task. This is a whole new profession that didn't exist until this program started, and we don't have anyone that has graduated yet. So we're just creating it kind of as we go, which is both exciting and challenging. Right now, our legislature is in session doing their 5-week short session, which generally means they're trying to do some technical fixes, make some budget adjustments, but big policy changes aren't always welcome during the short session because 5 weeks isn't very long, and it does fly by very fast. So a lot of work has to be pre-planned. I always say we got to pre-bake what comes for short session, otherwise it doesn't go very far. So my task this session has been in some ways to lay the groundwork for a larger conversation later on, next year hopefully, to think about how do we, and my husband will probably cringe when I say this because it's like a football analogy and I'm in Eugene and we all love the Ducks, flood the zone. We need more people in these kinds of jobs, and in order to do that we have to create a profession, and it has to be socialized with folks that make decisions and policymakers. And so we have brought forward a bill this legislative session, House Bill 4151, to just start a conversation about how we make space for what we call low intensity providers. So folks who can do the prevention and promotion work, the intervention work, take that off the plate of teachers who have too much else going on and aren't trained to do this kind of work. And then to allow for those with master's level clinician degrees to do what they're trained to do, which is to have these, to do the diagnosis and the treatment program. So this bill would essentially set a table to bring the right people to the room to discuss what it could look like to expand the workforce, to diversify the workforce, and of course to sustain it. Where are these graduates going to work? Who's going to pay their salary? And is it going to be fair wage, and a good career path for our undergrad students as they graduate, and for others in this kind of work. And it's going well so far. We had a public hearing earlier in the week. Randy alluded to the timeliness of it. I've been in Salem a lot this week, and the conversation has been a good one. It's an important topic, and there's a lot of attention on it. There's been a lot of attention on the adult mental health system in recent years, of course, and we do talk a lot about the needs that children have, but it has been a lot of the time been focused in the education sphere, which is important. But beyond our initial work in schools, we want to find ways to embed our graduates in other settings, healthcare, community settings. So, you know, if you're a nerd like me, get on the Oregon Legislative website, and you can track that bill, 4151, and then we'll hopefully be involved in that conversation and bring a lot of folks to the table to talk about what's next and how we create a credential or a what does a graduate need to go do this job, and how do we create it? And it's an exciting time, and a lot of important conversations to come. And I think I will turn it back to Randy to give you a little more, and then I'll come back and talk about our community engagement work. Thanks.
Thank you, Courtney. So I'm going to move through here because I'm using quite a bit of time. This curriculum is so incredibly exciting. It's amazing to have the freedom to design the curriculum that you would like to design without any constriction by accreditation standards or precedent or anything of that nature. So our faculty in psychology and education had a blast, I think, creating this curriculum because it's very clever. So one of the clever things about it is that it is a 2+2 program, and it's not unlike the bachelor's program in nursing at OHSU, where you get a degree from a college or a community college around the state of Oregon, and then you come to Portland for your last 2 years to do your clinical rotations and et cetera. So it mimics that in some ways. So it's not unprecedented in terms of that design, the 2+2 design. But the pre-major core curriculum requirements in psychology, diversity, equity, and inclusion, and human development are really important for this program, because this program is designed to be equitable, to be accessible, to be fair, to be inclusive. And so we try to set the table for that even in the first 2 years. Then when one comes to UO Portland, again, it mimics the OHSU nursing program a bit because that's when our students will be in schools, Portland Public Schools, Park Rose Schools this coming academic year in the middle schools, and in pediatric practices in their senior year, but they get an extraordinary amount of hours of supervised experience. Part of that $425 million donation, as I mentioned, went to faculty hiring. 15 of those faculty will serve as supervisors of our trainees in schools, which is an extraordinary resource. And because this program is it's new, unprecedented, it's unheard of, there's not a supervisor out there that's trained in this program. So Connie and Steve even thought of that eventuality, and we will have built-in supervision to create this new model and to discover how they fit into the existing workforce, how they complement the existing workforce with very careful supervision. And they'll learn a variety of promotion, prevention, and intervention strategies that work for children with a variety of risk. Children with depression risk, anxiety risk, attention deficit risk, behavior problem risk across the spectrum. And so that would be an exciting aspect of the program as well. And essentially, what we're doing with this curriculum is because much of the work we do in education, psychology, social work, psychiatry, and related fields has changed so much. Now we have, for example, telehealth, which is ubiquitous. We never had mental health telehealth in any significant way prior to the pandemic. We can incorporate all those innovations into the undergraduate curriculum because we have space, and we can do whatever we want with this curriculum, which is amazing. So the latest innovations in behavioral health have no barriers to entry into our curriculum, which is really exciting. So we can put some innovations in this curriculum that are difficult to fit in existing curricula because you have so many requirements already. And we can take some advanced curricula that's typically given at the master's level in behavioral emotional intervention, for example, and take that master's level content and move some of that content to the bachelor's level as well. So it makes a very exciting curriculum, quite an applied curriculum. One way that I think about it is not unlike an undergraduate degree in psychology, sociology-related fields, but with significant applied content so you can go out into the workforce like a teacher or a nurse does the first day and really have a meaningful impact on children's lives and their well-being. So that's incredibly exciting. School partnerships are exciting. I just presaged those. And the graduate micro-credential for educators was also funded by the Balmers. And this is intended to help children now, to not have to wait for graduates from the program. And so Connie and Steve were very enthusiastic about this idea from the outset because they knew from their other philanthropic work that teachers want more information about behavioral health because they know that they're not able to meet the needs, the social emotional development needs of kids because that was just not a core part of their training. And actually, we did some of this work probably 2 decades ago at the University of Georgia, and even there it was incredibly well received by teachers. Same thing is happening here with the Balmer Institute. So we created the first micro-credential offered by the University of Oregon, and it's a 3-course sequence that teachers take remotely from Eugene or Portland, from around the state. And it's quite a commitment for teachers. Every Thursday night, 4 hours a week, they're online taking a course in self-regulation, healthy relationships, dealing with social media, etc. All very current, important topics that children are dealing with and teachers are dealing with in their classroom. And it's intended to be applied, so every Thursday night, on Friday morning, the teachers on Thursday night learn a skill, and on Friday morning they're able to apply that in the classroom. And that's what they find most satisfying. You'll see these accolades on the Children's Behavioral Health at uoregon.edu website. So this has been extraordinarily successful. And we hope to continue to expand this, and thanks to the Balmers and thanks to the University of Oregon discounting tuition, all of these teachers get this credential and these full 3 courses for free at this point. Again, which is another access breakthrough that's being made by the Balmer Institute, which I'm really excited about as well. Back to our model. Everything about the Balmer Institute is embedded in community. It's one of the reasons why we're in Northeast Portland. It's one of the reasons we're in a community that has a history of being underserved. That was part of the plan from the outset from the Balmers, is to create access, to create diversity, to create inclusion, and there are a variety of ways of doing that. Scholarship, placement of the campus, having a bachelor's program so you can access the profession in 4 years instead of 6. All of this is associated with our efforts to be part of the community. And so I'd like for Courtney to return to briefly give you an overview of the work that's being led by Dr. Uthika Khurana.
Okay. I'll try to move relatively quickly so we have time for all the questions. So as Randy said, we can't do this without community, and we can't pretend to know what every community needs. So we have launched a community advisory board led by Dr. Khurana, which is really a way to hear feedback and hear from our community leaders and partners what they need from a program like this. We can't create something on our own unilaterally. We need help, and we need to understand what the needs are. And we have a variety of communities across the state. We're focused on Portland right now because that's where our campus is and that's where we're starting. And we've just had our first meeting last month, so we'll be doing that. They'll be meeting every 2 months for the year. And the sort of powerhouses in the room is really impressive. As somebody who's worked in Portland for a long time, it's a really, I mean, I just think it's an awesome testament, not only to the program, but to their leadership to be, spending their time with us to try to help us drive this forward and to figure out how we best serve their communities. So that's going well. You can see some of the organizations here, but it's also part of what we're doing in our legislative work is also making sure that there is a space, an important space for community voice as we develop whatever it is that we need to move this profession forward and into the bloodstream further. So we're just really grateful to have their time and expertise, and we'll continue to lean on community and ask for them to help us, and not pretend that we're the experts in everything. So it's going well, and we're going to continue that work. And I'll give it back to Randy. And then I think we're.
Thank you. So the concerns about us filling the time today appear to be unfounded. I apologize for that, but we are entirely too excited about the work we do at the Balmer Institute, and really want to help children and want to help them as soon as possible and as capably as possible. And we're also engaging in additional fundraising for the Balmer Institute, so I want to make you aware of that as well. And Anna Mulkey is our Director of Development. All right. What I'd like to do is turn it over to our MC to get to question and answer.
Thank you very much. We will get to question and answer in just a moment, but first I'd like to thank the business and in-kind sponsors whose support helps to make City Club possible. Thank you to our gold sponsors, Network Charter School, Hirschner Huntel LLC, and Evans, Elder, Brown, and Subert. Thank you also to our in-kind sponsors, KRVM 91.9 Radio, Alpha IT, Dotson's Photography, and Kid Sports. Also, a special thank you to our award-winning public radio station, KLCC FM 89.7, for airing City Club programs Monday nights at 7 p.m. For those listening at home or in the car right now, your household is one of several thousand tuning into City Club on KLCC, and we love that you're here. You can find all recent City Club programs archived on KLCC, as well as on our YouTube channel and as podcasts. We'll take a brief break before we come back for questions. Thank you. Welcome back to the City Club of Eugene and our program on the Balmer Institute for Children's Behavioral Health. Our first question comes from Justin Radabaugh, the principal of Lane School here in Eugene, which provides support to students with social, emotional, and/or behavioral needs. Justin.
Hi there. So yeah, I'm the principal at Lane School. It is a K-8 alternative program for students who have an emotional or behavioral component to their profile that impacts their ability to be successful in a comprehensive setting. I get to experience the more treatment side of what has been talked about today, and that piece of where when systems aren't in place at an early stage and school systems aren't meeting the needs of kids that have emotional and behavioral needs and struggles, that they get referred to my program. The idea of building a workforce that will impact that prevention side of things is exciting. That to think that schools will have more ability to do that, or other environments will have more ability to do that. My question comes in on the philosophy around the curriculum that you were so excited about. Kind of what is that cornerstone that you're pushing as you think about all of the acronyms that are out there, PBIS, CPS, all of the acronyms that have their cornerstone that they're anchoring to, of whether it be students do well if they can, or behavior is a form of communication. What is this, when you've built this curriculum, what was that cornerstone of what you're trying to instill as a theory and a touch point for the students that are coming out of that program?
Justin, thanks for that insightful question. We purposely brought together a group of faculty from a variety of theoretical perspectives. So we had faculty from child clinical psychology, faculty with special education backgrounds, faculty who are community engagement experts, and it was incredibly educational for me to watch them work and take all these diverse perspectives, neurodiversity perspectives, et cetera, and bring them all together and decide what to do. That group, regardless of their varied backgrounds and perspectives, all decided that we could do the most good if we worked upstream in the early identification of risk and then the mitigation of that risk. Now, that has been informed by the work of Dr. McLaughlin and her colleagues. One thing that Courtney didn't mention is that we have, in addition to the local community advisory board, we have a national advisory board that Dr. McLaughlin is forming as well. And that's bringing in some of the best minds in the U.S. and actually outside the U.S. to continue to inform and continually renew the work, because we don't have our students in our first third years until fall, so we have some time for refinement. A couple of the areas of foci that were there from the outset and they're still there. One is early identification, this notion of finding ways to find kids earlier with mild risk that parents can't detect, and teachers have trouble detecting as well. So that's the sort of public health, universal screening, early detection. There are a variety of languages associated with that work that we're just not doing for children and adolescents. And so that continues to be a core of the work, where they get to special education without knowing who might need them. Then the second part of that is, what's the nature of those interventions? And Dr. McLaughlin brings with her a common elements approach. And this common elements approach comes from research on the West Coast and the East Coast at UCLA and Harvard and a few other places, where researchers in psychology in particular have tried to identify things that you can do for kids that work for kids regardless of whether or not they're in special education, regardless of risk status. And these are, as in my lay terminology, sort of lifestyle interventions. And that's, for example, like relaxation or decision making, healthy decision making, self-regulation, relationships with family, relationships with peers, and how to build strong relationships. And those common elements are not associated with a diagnosis, they're not associated with a particular program. They're just mild interventions that seem to work for all young humans to improve their behavioral health. Those are some thoughts about that.
Thank you. Next question.
Can you hear me? Okay, thank you. Thank you for the presentation today. I'm really glad to hear you're wanting to hear from community voice. I'm Amy Fellows, a parent of a neurodivergent teen and part of a group of parents, teachers, and therapists who have been watching closely since Balmer Institute started, with concerns over the approaches that may be used, as many of our students have been harmed by the positive behavior intervention and support and applied behavioral analysis the U of O has been pushing into the schools for years. Focusing on patterns of behavior that are meaningful and predictable can be harmful if you are taking data on externalized behaviors and don't understand the why and have not built relationship with the child. How will you help support the adults in schools better understand their neurodivergent students' why, the sensory, communication, and mental health supports needed in a way that does not use behaviorist approaches that are currently pushing these students out of schools at record rates statewide? Are your students aware of understanding the why behind behaviors that may be due to sensory or communication challenges and the trauma that comes from these kids being grossly misunderstood at school and sometimes at home? Are adults in schools taught about their own nervous systems so they can serve as co-regulators? You cannot teach self-regulation if the adult does not know how to co-regulate. How are you engaging with the systems of care work at the state level or with Trauma-Informed Oregon that works out of PSU? Thank you.
Thank you. Yeah, all important topics, and I'll try to address at least a few of them. With regard to the making sure our students are aware of issues such as co-regulation, for example, our teachers in the micro-credential program are mimicking teachers internationally. There's been a lot of good research in India about training teachers in how to help students regulate. And invariably, our teachers are doing the same thing. They adopt the strategies and use them upon themselves. So that's an ubiquitous international finding that we're finding here in Oregon as well. We really worked hard to put together a group of faculty and students and other groups to inform the work at the outset. We've heard this concern about PBIS previously, and I've been out of the PBIS. I've never actually had a foot in the PBIS world, so I'm not sure what the current status is of that in Oregon. But that's one of the reasons why we do have a course devoted to neurodivergent thinking in the curriculum. And that's very exciting. And we continue to hire faculty that have relevant expertise, especially one that's coming in this fall, to be able to deliver that work in, I think, the authentic, powerful way that you're seeking, for our undergraduate students. So those are a couple thoughts about that.
And I can speak to your question about the System of Care Advisory Council, which is a state-led agency to bring together the different systems that serve our kids, and they're generally in multiple systems a lot of the time. And so just real quick is the bill that I referenced earlier is going to be most likely amended, and that amendment would move the work from OHA into the System of Care Advisory Council. So we've been talking with Anna Williams a lot, and so we still want to make sure that culturally represented voices are heard and that that's part of that subcommittee process. It sounds like it is, but we've just been working through some of that with them. So hopefully that answers your question.
We have time for one last lightning round question, Roz.
Oh.
Go for it.
Okay, really quickly. Roz Stein, I'm a City Club member, and I have some experience in my life in Los Angeles as a principal in a program that had severely emotionally disturbed kids. It was a regional program. And One of the things I just really wonder how you're going to deal with is the involvement of parents. Parents who may say no, they don't want the social emotional testing done. And those are some of the ones that probably need to. I just think, because I've seen that. So I just wonder how I'm going to deal with it.
Yeah, there are 3 states now, which is unprecedented, that are requiring students in those states to be screened. Colorado, Illinois, and New Jersey. And this thing is picking up momentum because too many kids are suffering because they're not identified. At the same time, all these laws give all the power to parents. And so they're all requiring that school districts who do this work engage in extraordinary efforts at informing parents and giving parents agency to not participate in this work whatsoever. And it depends on how you go about that, but you can get pretty good cooperation from most parents. At least that's what we found in our experience, but we absolutely respect that right to not participate. And with children themselves, it's common practice to make sure the kids themselves want to participate and give their assent as well. So that's central to this work. And legislators seem to have this top of mind for themselves because you see it enacted in new legislation.
That's all the time we have for questions today. Please join me in thanking our panelists. This has been our February 9th conversation at the City Club of Eugene. A special thank you this week to the staff of Reynolds Electric and Plumbing, who hosted the Industry for Educators class last week. Yogi T, who hosted the Industry for Educators class this week, and Lane Transit District, who will host us next week. It's going great, and we really appreciate it. The Eugene City Council will be holding public hearings on Monday, February 12th and Tuesday, February 20th, with many key issues on the agenda, so make sure you make your voice heard, either in person or via email. We at City Club will not be meeting next Friday in observance of President's Day, but we'll be right back here at the Maple Room for a conversation on the youth peer-to-peer support that's on February 23rd. Until then, peace be with you. Thanks so much.